Hi, my name's Leo. I've been working at college for about 3 years in various roles, but I'm currently the EDI advisor. I was first diagnosed with ADHD around 2 years ago, but previous to that I was diagnosed with dyslexia at about the age of 7. My ADHD symptoms present differently during different periods of work, so when things are a lot more busy and there's multiple projects going on, I find it harder to focus on certain topics, and my organisational skills can be affected. Usually when I'm stressed I find it harder to keep on top of work, but there's a few coping strategies that I've been working on. It can also present differently if there's things going on at home. So recently I've been renovating my house, and with the disruption with that and the disruption in sleeping patterns, it can also affect my concentration during day to day. I also think that my ADHD symptoms fluctuate seasonally as well. For my dyslexia as well, what I find helpful is Grammarly, and that's really supportive of just like correcting spelling mistakes or grammar that I might not have picked up. What also helps is having a good schedule and routine. So as I said, sleeping has a big effect on my productivity during the day. I've also recently started medication for my ADHD. This isn't always helpful for some people, but in my case I think it helps me focus in on certain projects, get less distracted in the office. I also find it really useful to book out rooms, so if the environment around me is quieter, I find it easier to focus on certain tasks. I also find body doubling really helpful, so this is when you co-work with someone, not necessarily on the same piece of work, but if there's someone in the room also working, I find that helps my productivity as well. In terms of those who've been recently diagnosed, I think there's a lot of research out there that you can find, a lot of tips about how to manage your time or manage your workloads. What I find useful is also going on TikTok and seeing people talk about their own experiences on ADHDs, like life hacks that help them be more productive. They talk a lot about uncommon symptoms, things that you might not even know are related to your diagnosis. I would also say that the medical route is not always for everyone. There's a lot of side effects that come with being on medicine for ADHD, such as struggling with sleeping or also loss of appetite. So that's a bit of trial and error. I think if you're working with your psychiatrist and talking about your symptoms and being quite open and honest with that, they can also help you with that. For access to work, I've got an ADHD coach, and basically they help me plan out my itinerary both in my personal life and at work. They help me find coping strategies that help me focus, and also just to talk to someone that's also had lived experience of ADHD as well.